Okay, so for the next part, I'm going to be the clinician and Kristen's going to be the client. We are going to be addressing phonation, which is the next subsystem that is affected, and it involves the production of voice and sound. So the first exercise that we would want to do for the patient is the pushing and pulling exercises, and this helps the vocal folds or the vocal cords to adduct. So I would instruct the patient to push their arms up on the chair while they phonate an open vowel sound, or I would ask her to pull up on the edge of the table by prolonging a vowel. So I'm going to do that right now. So Kristen, would you please go ahead and push up on the arms of your chair while you're phonating an open vowel, like ah.
Okay.
Very good. Okay. Now go ahead and try pulling on the edge of a table and then prolong your vowel. Good. Very good. Okay, so the next thing that I would want to look at is if they can do a hard glottal attack. I would ask them to hold or take a deep breath, hold it, bear down, and attempt to phonate a tight ah sound. So, Kristen, would you please take a deep breath, bear down, and attempt to phonate an ah, like this. So, ah. Very good. Okay. The next way that we can help Parkinson's patients address phonation is with the use of an amplifier, which is like an FM system, and it helps a patient whose voice is particularly breathy or soft. So that can be used. The fourth thing is biofeedback can be used, and it's an electronic device that provides visual and auditory feedback on the patient's pitch, loudness, and rate, and we're going to show you that right now. Okay, so I'm going to have, so it looks like this, and I'm going to have Kristen phonate a clear ah sound. Go ahead.
Ah.
So as you can see, the line went up. All right. Okay, and then the last thing that we can help these people with is helping them to think loud, and that would be by using a Lee Silverman voice treatment. And this is an effortful phonation program. It requires the patient to practice daily and to have treatment sessions daily in which they are constantly reminded to think loud. The first part of this therapy is, I just mentioned this, is it strictly increases or helps them to increase their vocal loudness. The second thing is it requires multiple repetitions of high effortful phonations from the patient. The third is that treatment must be completed daily, which I touched on before. The fourth, patients must be calibrated for what is their normal loudness. And then last, their progress must be quantified. And that's it for phonation.